Hi guys, I'm sorry we just weren't able to quite get this last slide on there. And again, I have deleted chapter 60 because we are not covering that. Um, Diverticular disease. Diverticulosis is the presence of many abnormal pouches like herniations in the wall of the intestines. Remember, with diverticulosis, it is usually they have no symptoms, okay? Diverticulitis is an inflammation of the diverticulum. When you have a inflammation of the diverticulum, they generally will have pain. It's usually in the left lower quadrant. It can be intermittent at first, but it becomes more steady. The abdominal pain is more generalized if peritonitis is present. Okay? So, what assessment findings are we going to do with these patients? Again, we're going to take that history. We're going to look at their pain. We're going to see if they have a fever. A lot of times, these patients will have low grade fevers, they'll have nausea. You want to know their history of bowel movements. What do they look like? When were they first diagnosed with the diverticulum? Um, do they have abdominal distension? Is there any signs and symptoms of peritonitis? So how do we care for these patients? Well, as nurses, we're going to make sure that we're monitoring for prolonged or increased fever, abdominal pain, or blood in the stools. Causes for hospitalization can include a temperature greater than 101, persistent or severe abdominal pain for greater than 3 days, and or a lower GI bleed. All of these would be a reason for someone with diverticulitis to come in to the hospital. They're also treated with broad spectrum antibiotics and analgesics. They are generally, you avoid laxatives and enemas because you want to avoid that extra stimulating of the bowel. Um, they will have surgery for peritonitis if ruptured. Sometimes they'll have an NG tube, but quite frankly, I don't think I've ever really seen one. So that would have to be a pretty severe case. I would think if they had peritonitis, they're going to end up with an NG tube, but not just for diverticulitis. Um, you also want to make sure that you're assessing for fluid and electrolyte imbalances as well. Now, discharge teaching, remember, when they're being discharged, we're just teaching they're discharged with their diverticulosis, okay? So this is when they have the presence of many abnormal pouches in that intestinal wall, but they do not have inflammation at present time. These patients need to be on a high fiber diet. They need to avoid seeds and nuts, corn, popcorn, cucumbers, figs, strawberries, tomatoes. Um, and but now what's important to know that is in times of itis, when they have the diverticulitis, the inflammation of a diverticulum, you want to avoid high fiber foods. Okay, so that's important to know that you want to make sure that have high fiber foods when they just have the diverticulosis because they have those outpouchings to keep everything nice and formed. But when they are having a period of inflammation, you don't want to cause increasing gastric disturbances with that high fiber diet. And at no time do these patients need to be taking anything that has seeds, nuts, popcorn, all of those itsy bitsy tiny things that can get caught in the diverticulum and end up causing diverticulitis, which is that inflammation. Um, I hope that was helpful. Again, we are not covering chapter 60. That is the reason it has been deleted from this slideshow, but it is in the original one. That's it. Thank you.